Good afternoon, everyone, and welcome to the very first session of Community Health, Community with Confianza, a health literacy eco series. My name is Dr. Raquel Romero, and I will be the facilitator for the eco session today. This session is brought to you by Health Confianza team in collaboration with the UT Health San Antonio Super Hub, the YMCA, South Central EHEC, and the University of Texas at Austin. Please let me start by saying that Health Confianza is a community-wide health literacy program that aims to provide health literacy education, training, resources, and workforce development for Bejar County and the surrounding areas. Our team believes that health literacy is critical to transform health and achieve health equity for all, with the goal of increased health literacy in our communities. And those sessions were carefully prepared to equip with tools and skills to all of those that attend the sessions. Each session builds upon each other. So we encourage you and we invite you to attend all the sessions to enhance your learning experience. Now, for those that are new to the ECHO platform, ECHO stands for Extension for Community Health Outcomes, and it serves as a virtual telementoring stage specifically designed to create connections between communities and subject matter experts, in our case, with the field of health literacy. ECHO sessions have the following components. We'll start with welcoming and announcements, and then we do the introductions, followed by didactics, and then we have a case presentation. A case is an important component of the ECHO model. We invite you to submit a real life story. The remaining part of the ECHO is devoted for a dynamic discussion with our group. It is important to mention that no personal health information is allowed to share at any point of the session. So what is personal health information? Well, that includes DOB, date of birth, addresses, appointment dates, etc. We are recording this session today, so we can share it later. I would like to mention that those sessions are open to everyone. Once you register for one session, you automatically will be registered for the complete series. Please mark your calendar for the following sessions. To earn continuing education credits and certificates of participation, please complete a post-session survey using the link that is going to be presented in the chat. Before we go to the team introductions, there are a few technical points that I would like to mention. Please rename yourself in Zoom to reflect your first and your last name. To help us with our attendance records, using the chat, please enter your full name, your affiliation, and an email address. You can also use the chat to write your questions, comments, perspectives through the session today. And please remember to stay muted only as you are speaking. We promote interaction in our sessions and we would like to see everyone's faces. If you are comfortable and you are able, I invite you and encourage you to join us by video, especially in the discussion part of the session. If you're having connection issues at any time, please don't hesitate using the chat and send a message, private message to Angela, to the ECHO IP for assistance. So let's go to now for the brief introduction for our team. Please unmute yourself and introduce yourself. Well, let me go to the team and I see Dr. Rosenfeld.
Hi, good afternoon. My name is Jason Rosenfeld. I'm an associate professor, Department of Medicine here at UT San Antonio. Sorry, I got to get it right. We just rebranded. So it's good to be with you all today. I am also the co-director of the Health Confianza program. I'll tell you a little bit more about myself in a little bit, but it's wonderful to see you all. Thanks.
Thank you very much. I see Dr. Melanie Stone.
Hello, everyone. I am Dr. Rosenfeld's colleague here at UT San Antonio. We co-direct Health Confianza together. I'm an assistant professor in our Department of Family and Community Medicine, and I also direct our Community Engaged Learning program at the university. It's good to see you all.
Thank you very much. Dr. Adelita Cantu.
Yes, I'm here.
Okay.
Sorry, my fingers didn't move fast enough. Good afternoon, everyone. My name is Adelita Cantu. I'm a professor at UT San Antonio School of Nursing, the new brand there. I also work with Jason and Dr. Stone with the Health Confianza team. Thank you.
Thank you. Thank you very much. Corinne Reyes.
Hello, everybody. Corinne Reyes, YWCA San Antonio Chief Program Officer of Health and Education. Coming here after, participating in the Health Organizational Literacy program with Dr. Stone and Dr. Rosenfeld, and happy to see everybody.
Thank you very much. Ariel Gomez, I don't know if she joined, I think it's so. Ariel, I don't see this word, but maybe she can join us later. Well, thank you very much. And finally, I would like to mention that ECHO is all teach, own, learn environment. So we encourage you to share your experience, your questions, and your insights to the session today. So with no more from my end, I would like to move to the didactics presentation.
Right. So again, welcome everybody to our first session of a 6-part health literacy echo series. And we're really excited to have you here today. I was looking at the chat of who is joining us. I see a lot of our current Health Confianza partners. I see some of my students from School of Public Health. I see people from as far as New York City, Detroit, Colorado. So we have a really diverse group with us today. And our goal with an ECHO is to have a community where all of our participants share their experiences and their expertise. So we look forward to your active participation. I'm going to begin today by giving you just some overview and background on health literacy before I turn it over to Dr. Rosenfeld to tell you a little bit more about our initiative with Health Confianza, and then we look forward to having a good discussion with you later on our case. So I'm going to share a few slides with you. All righty, so our name of this series is Communicating with Confianza. Confianza meaning trust and confidence in Spanish. Health Confianza was intentionally created with the dual language to reflect our community and our goal of being very inclusive. So we're excited to have this series. Again, 2 presenters today for your ECHO. And we're going to talk about health literacy as well as organizational health literacy, talk about some of the impacts of health literacy. I hope you'll see with me why health literacy is such an important issue in our community. And then we will go into some of the specific programs that we are offering through Health Confianza. And before we start, I just wanted to give a little bit more background about myself. So I am a public health professional. I have been interested in health literacy since really the mid-2000s. That was a long time ago. And at that point, health literacy was not as known or well known as it is now. I was working for our county hospital system called University Health, and I was seeing the issues of health literacy without really knowing that there was a context to it, that there was an actual field of health literacy at that time. And so as I was working with clients who were struggling to adhere to their medication regimens, to have follow-ups with their appointment, follow instructions, I was also seeing from the healthcare professionals that there was maybe a lack of understanding and empathy of why their patients were struggling. They would tend to, or some of them, I should say, would label the patients as non-compliant. And I knew there was a disconnect there because I was seeing both sides of the equation. So I got interested in health literacy. I joined a local city initiative called the San Antonio Health Literacy Initiative. And from there, I've just really been involved in this field. I do a lot of work now of training our healthcare professionals, our students who will be representing our future healthcare workforce, and more recently with organizations, both clinical and community-based. And so it's a field I'm very passionate about. I've had my own family struggles with health literacy, as I'm sure all of you have. And so I think we all have experience in this area. So I'm going to start out with just kind of level setting with the traditional definition of health literacy. This is from the Institute of Medicine back in 2004. And this is the definition most people are familiar with. We'll talk about some important updates, but basically the concept, it's the degree to which individuals have the ability to obtain, get that information, process it, and understand it. And so with a goal being to make appropriate health decisions. Again, this definition has been updated, but this is what people tend to think about health literacy on a personal or individual level. And I want to review some basic concepts about health literacy so we're all on the same page. It's important to note that health literacy is not the same as literacy. A lot of people associate health literacy with ability to read. And it does include that. That's part of the equation, but health literacy is broader. It includes skills in numeracy, communication, and probably most importantly, the ability to act on that health information that people receive. Health literacy is a patient safety issue, and low health literacy has a direct link to poor health outcomes. I'll talk more about that in a minute. So not surprising, then low health literacy has been estimated to cost our U.S. economy between $106 billion and $236 billion annually in unnecessary healthcare expenditures. That number is from several years ago, so I'm sure it's even more now. We believe, and a lot of experts believe, that health literacy is modifiable at different levels. So you can intervene at the individual, the interpersonal, organizational, community, and macro level. And we will discuss this multi-level approach later when we describe our Health Confianza program, which is based on that premise. And, there's robust evaluations of health literacy and interventions that are needed, right? This is something that is harder to evaluate and measure, but there is progress in this area. And I just want to point out that the county health rankings and roadmaps, one of our evaluation measures, ranks health literacy interventions as having evidence for expected benefits to the population, including improved health-related knowledge and adherence to treatment. So like I said earlier, low health literacy does have a direct link to poor health outcomes. These include less ability to follow medical advice, actual documented worse health outcomes, such as blood sugar control, less healthy behaviors, such as using preventive services, particularly immunizations and screenings, more hospitalizations. Some studies have documented higher mortality among seniors. And the point is that health literacy is actually a stronger predictor of a person's health status than educational level, socioeconomic status, gender, and age. So it's really important that we address low health literacy. These are some of the common challenges. So what does it look like when a person struggles with health literacy? What does that mean? Well, they may have trouble just understanding directions to a clinic. And then once you're in a space, how to navigate and find your way to that space. And at first you may think, well, that's not really affecting their care. But as I have talked to providers, they tell me when a person has this struggle and then they come late to their appointment, well, now they have less time to have that interaction with them, less time to educate them, and that does impact their health literacy. There's a lot of challenges with communication between the patient and the healthcare provider. Medication instructions are very, very important, that you understand exactly how to take your medication. Being able to go to a follow-up appointment. Informed consent. Can we be assured that the person who's agreeing to a procedure really understands what's happening to them and the effect of that? Trying to navigate health insurance at all levels is very challenging. So these are just a few examples, and I invite you to offer other areas that you have encountered, and please share them in chat. So you can just post them and we'll kind of monitor that as we go on. I do have a question for you. So, like I said, this is an interactive presentation. I have a question. How many Americans do you think struggle with health literacy? Is it A, 10%, B, 50, C, 75, or D, 90? You can just put your letter choice, A, B, C, or D in chat, and I'll see what Raquel has to say.
Yeah, I have a lot of C's and B's, C and D, C and D. I think those are the most common answers right now here.
Which one's the most common?
Let me see that. Let me see. And is there a person that would like to verbalize a little bit why it was C, why it was D? Open in the chat.
It looks like there's mostly C's in the chat.
Mostly C's. Okay.
Thank
Thank you. That actually is pretty much the response I get every time I ask this question. People tend to choose C. Guess what the answer is? D. Unfortunately, I wish it wasn't true. But this is based on a study that was done the last and only time we have had a national survey of health literacy was in 2003. That's a long time ago. It was part of the NAL, the National Assessment of Adult Literacy. And they found that nearly 9 out of 10 adults had difficulty using everyday health information. It was a very extensive survey. They did telephone calls and they talked to people and they were able to rank them into these 4 categories. These are based on the level of the ability for someone to complete a task. So just for example, if you're in the proficient level, you can calculate your share of health insurance. It's very challenging to do that, right? Yeah, I'm sure we all struggle with that, but that means you are proficient. And it goes all the way down to being in the below basic where the best you can do is circle the date of a medical appointment. That doesn't mean that you know a lot about what that medical appointment means or your follow-up instructions. So as you can see, more than a third of our population was either in the basic or below basic. And we believe that, in the US healthcare system, you really need to be in that proficient category to be able to navigate the health system well. And like I said, this was done quite a few years ago, but there have been related surveys in more recent years that confirm this data. And they show that health literacy is not improving and remains a challenge due to increasing complexity of our healthcare system. And those who are in the basic or below basic categories can have serious or even deadly ramifications, such as not taking their medications correctly. We can talk more about this later with our case study, but if you can't follow your medication regimen 100%, you are at risk for having a complication or, something very serious could happen. And so that's, again, why health literacy is such an important issue, because it can have deadly consequences. Health literacy is also a health equity issue. Certain groups are more at risk for having low health literacy. I'd like to say here, all of us can struggle with health literacy at times. It's situational. You may be in a setting where you receive an unexpected diagnosis, or maybe your child has received a diagnosis, and maybe normally you have pretty good health literacy, but at that time, you might be in shock, or you might be, very concerned, and, your health literacy may not be as high at that point. The point of this is that some groups tend to have low health literacy more generally, and these are vulnerable populations who might include people from certain races and ethnic minorities, people with a low income, those with a high school diploma or less, immigrants, those with limited English proficiency. And because of this, health literacy is considered a social determinant of health. Here in San Antonio, we are challenged with significant health disparities. This map shows you that NAL data that I presented earlier, and it shows you by quartile, those 4 quartiles, how it's mapped out in our San Antonio community. And you can see that very obviously people in the southern, southwest, southeast regions of our county have the lowest health literacy compared to the dark blue area, more in the north section. This map correlates with a map that came out, several years ago here in San Antonio that shows a life expectancy discrepancy based a 20-year life discrepancy based on where you live geographically. And so people who are living in the north side of San Antonio live 20 years longer than people in the southernmost. And so it correlates with that. Another map it correlates with is higher, back when we were first experiencing COVID here, with our higher COVID case rates, same distribution, and COVID death rates. And so unfortunately, that means we have some work to do in our community. Jason will tell you a little bit later about how we are addressing those disparities with Health Confianza. All right, I would like to switch now to that earlier definition I presented to you of health literacy has been updated. So Healthy People 2030, which is our nation's public health agenda, has updated the definition of personal health literacy from that IOM definition I presented earlier. So you'll see that it now emphasizes people's ability to use health information, not just understand it. It focuses on the ability to make well-informed decisions rather than appropriate ones. It also has added a definition for organizational health literacy. This is bringing a public health perspective by emphasizing the role of environmental and structural factors that very much affect patient outcomes and population health. So it acknowledges that our organizations who help people understand health information, whether it's a clinical setting or a social service or a nonprofit, have a responsibility to make their services easy to access, understand, and use by their clients. So newer models of health literacy also emphasize that the majority of health information exchange happens beyond clinical walls, where people are actually spending their everyday lives. They're getting their health information from schools, churches, workplaces, radio, social media. And so this is where we need to focus on that health communication exchange. So our focus on low health literacy may seem discouraging, but through education, training, and policy and systems changes, we can move the needle. And these concepts will be covered in our Communicating with Confianza Echo series. So we're giving you the foundation today, and our future sessions will kind of focus more specifically on these areas. To summarize what we've been talking about today, these are the guiding principles that serve as the foundation of health literacy. Remember, literacy and health literacy are different. Low health literacy, unfortunately, is very common. It is a predictor of health status. Shame is a major barrier. We didn't get into that a lot right now, but we will as we go into our series. It's associated with higher costs, and you can't tell by looking. So that means you can't tell that a person has low health literacy just by looking at that person. I'm going to share a video next that portrays that. And then the last basic of health literacy is that providers have limited training. It's still true that they do. And so we are hoping to fill that gap through our training series. And I just want to play this quick little video, Mrs. Walker, who talks to us about what it's like to be a patient with low health literacy. And you can, Mrs. Walker is very eloquent. You wouldn't just assume she had low health literacy if you interacted with her. And part of the issue is patients will try to hide it. And so let's hear from her.
One of the things that most of us learn how to do is to hide it exceptionally well, because it's a terrible embarrassment, and the shame that goes with it is devastating. So the last thing in the world you want an intelligent doctor to know that you have any kind of problems other than the ones that you're there to see them about.
With that, I'm going to turn it over to Jason to give you some more background on Health Confianza.
Great. Thanks, Melanie. And so I want to take just a few minutes just to introduce you all to our program here, which was born out of the COVID-19 emergency response. And so, as public health professionals, when we were involved in responding to COVID-19, our primary focus was on how do we get good information out into the community about all the changes that are going on, the ever-changing landscape of vaccines, preventive health, whatever it might be, but do it in a culturally appropriate way, leveraging, as Melanie was just talking about, community partnerships and the places where people were going to get that information, right? And so recognizing that oftentimes that wasn't doctors, it wasn't the healthcare system, it wasn't the public health system, but it was, community partners like the YMCA, the YWCA, our faith institutions, our schools. And so, this is where our genesis came from, really, with this focus on community, on compassionate communication, and really trying to build and rebuild trust and confidence for people. So, Melanie, if you go to the next slide, this talks a little bit about our mission here. Which is we do believe that together, and by together we mean ourselves, our community partners, and community, that we can help create more informed, confident, and healthier communities. We were very intentional about utilizing the dual meaning of confianza. For those of you that speak Spanish, you'll recognize that it can mean both trust and confidence, because ultimately we wanted to help rebuild our community's trust in ourselves as healthcare providers, as social service providers, as public health practitioners, but also help rebuild people's confidence in making good decisions for themselves. At the end of the day, that is our purpose. How do we help people make good decisions and reduce as many barriers to accessing health and social services as possible? So how do we do that? The next slide shows the multi-level strategy that we designed, and this was very intentional. Again, leaning into some of the principles that Melanie was just describing about how most health literacy interventions were focused on, or have historically been focused on, the individual community member, the client, the patient, whatever term you want to use, and we're going to help change their literacy level. But it ignores the fact that there's a system in which these people are seeking care and seeking services that may not be health literate, may not be acknowledging their perspective, may not use plain language when communicating with them. And so we intentionally designed this multi-level strategy to try to address and move the needle on health literacy at a broader level, rather than just focusing on the individual user themselves. And so those three levels are community, health workforce, and organizations. And I want to just quickly touch upon some of the strategies within each of these levels, and also say, for those of you that are calling in from outside of Bexar County or San Antonio, while this is specific to our program here, we believe that this is a model that can be replicated anywhere, whether it's in whole or in pieces. And so we would love to speak with you about what your interests are and how we can assist. So let's start with the community. Next slide. So the way we've approached some of our, before I do that, where are we intervening? So the map on your left-hand side was our original intervention catchment area, 22 zip codes identified using COVID-19 cases, hospitalizations, and deaths as our priority zip codes. The map on the right is our new implementation area, expansion in collaboration with Bexar County Public Health. So we're really trying to cover those historically underserved communities with the highest health disparities here in San Antonio that Melanie was just describing before. All right, now we'll talk about community. So how do we approach this? In a number of different ways. We try to partner with ourselves as well as other community partners to do mobile vaccine clinics and health screenings to help reduce barriers to accessing those services. We also have trained Confianza ambassadors, which are kind of peer natural leaders in our communities. We have a deep dive peer-to-peer educational model called Community Health Clubs. Our next slide, and this is all wrapped around like a very effective and comprehensive social media and mass media marketing campaigns to, again, get good information out. The next slide talks a little bit about our new ambassador cohort. So we trained 15 community leaders across San Antonio, Bexar County in the last 2 months. And these are our ambassadors. They are nested within nonprofit organizations, within small businesses. They are leaders who have dedicated themselves to helping to create innovative messages around preventive health topics, and then to disseminate them both themselves as well as through our social media and mass media marketing campaigns. So those are some of the community interventions. At the highest level, at our organizational level, we have what's called a pledge program, where we're doing a deep dive organizational capacity building and training program this year with 8 organizations. In our first iteration, we did 10. And so those organizations are listed here. You can see it's a balance between nonprofit organizations, social service organizations, and healthcare service delivery organizations. And for the next 8 months, the next slide talks about the learning collaborative that these organizations will engage in. And so over this period of time, they're going to be reflecting upon their own organizational practices, policies, and systems, learning from health literacy experts from around the country, which are guided by these 10 attributes of health organizations and the national class standards, to reflect upon and then to take action to change their own policies, practices, and procedures so that they become more health literate when serving the communities and the populations that they serve. And then finally, we have our workforce level strategies. And this is what brings us here today, where we focus on community health workers, healthcare providers. We've done a K through 12 school nurses webinar series with the understanding that our school nurses, and many of you probably can confirm this, they are at the very tippy point of having a lot of these conversations with parents, with students, with teachers, but they don't always get the support and the resources to do that. And so I wanted to share just a little bit about our health, the Echo series that we have started today, which on the next slide is kind of the flyer for. And really the goal here is to operationalize and help you build your skills to integrate health literacy principles into your everyday life. Whether you're a clinician, whether you're a community health worker, a pharmacist, a social worker, there's always things that we can do to improve our ability to best meet people where they are, using principles of health literacy to then help them make good decisions for themselves, right? Our job is not to wag fingers and tell people what to do, but to bring them that information, help them using shared decision-making models, and then guide them towards the health that they would like to see in their lives. So I believe that is the end of my piece. And so I wanted to, again, thank everyone for joining us. It's so exciting to see people from around the country here. And we'll now turn it back over to Raquel to lead us into the case discussion.
Thank you very much, Dr. Rosenfeld and Dr. Stone. I think this is fascinating. You mentioned very important points, like to use and understand health information. And also it was mentioned that we may have a little bit, maybe a lot of experience in this area. So I open up this space for questions from the audience, but I know there are some already in the chat. Is one question, and in these definitions of health literacy, what is considered a good healthcare decision? For example, if a client appears to understand and be using that information in a well-informed way, and yet they make a decision that does not align with the best practice, is that a good decision or not? Dr. Rosenfeld, Dr. Stone, please.
Well, I see one of our hub members, Corinne, who has been very much part of our Health Confianza team over the years. Corinne, do you want to respond to that?
Yeah, I mean, my opinion is that it would be a good decision because it's an autonomous decision. Our job is to educate the patient, and then their job is to make the choice, whether we agree with that choice or not. So I think it's still a good decision.
Yeah, I think Jason and I agree with that. You know, as you may recall, that first definition of health literacy was talking about appropriate health decisions, which implies that there is a right or wrong decision. And as we have evolved with our definition of health literacy, we understand that it needs to be a well-informed decision, meaning that the person who is making that decision for themselves or their family needs to have all the information that is understandable to them. So it's not enough just to give them information. You need to make sure they understand it. Once they have that information and they understand it, it is up to them. It is their choice on how to proceed with it. And we are not here to tell them you're making a good choice or a bad choice. We're here to make sure they have that information to be able to go forward. One of the newer areas that we're going to be moving into with Health Confianza is, I'm just going to give you a little preview, is going to be a roadmap of how to adhere to preventive health recommendations. That can be very complicated depending on what age group you're in. And we are going to make that information available to people in a way that we hope is going to be much easier to follow, digest. And one of our tools with that will be a decision-making tool to help them go through that decision-making process. Jason, I don't know if you have anything else to add to that.
The only thing I'll do is just maybe make it even a little bit more concrete. And like, so oftentimes I think about this in the context of vaccinations, right? And so oftentimes we perceive the decision to be a black and white yes no decision, but the reality is most people when it comes to vaccines are on a continuum of some sort. And so what I view it as is our responsibility as communicators, as healthcare providers, as support to an individual making that decision is to give them the information and ideally nudge them along that continuum as they're kind of processing and making decisions for themselves. But if at any point we then bring shame or judgment to the decision that that individual is making, then you have actually now set your own self back a number of steps in that effort to try to help them, make that decision for themselves, if that makes sense, right? So the minute that you acknowledge like a negative or tell them that they're wrong, the conversation's over and there's no way to continue any further. And so it's about trying to keep it moving forward and helping them understand what decision they're making and what the implications of it can be.
Yeah, I think this is very, very important just to remember that everyone wants to be heard and we to be understood. I think this is a very, very important point. Is there another comment, question?
I know
So,
there is a question here about how to become an ambassador if you're not in San Antonio, so I just wanted to put that out there. So
yeah.
Yeah, I appreciate that question, Elizabeth. Without going into too much of a history here, there were other awardees of the grant that allowed us to start Health Confianza, and a lot of those awardees that were doing health literacy programs were also focused on ambassador-like programs where they were training individuals in the community. From my side, we have modules that we've now created that I'm more than happy to have conversations with folks about, like, how can we replicate those? How can we get them out into the community, and help people become an ambassador, whether it's a full title or if it's just a training and a skill set. So I'm always happy to have those conversations.
Thank you very much. There is another question. Rita, you wanna elaborate a little bit more on that question? On that, yeah, that question?
Yes, right now with the changes that are happening at the national level now from institutions, public health institutions, I'm a little concerned, and I know it hasn't happened, and we still can trust the information that has been there up to now, but I'm a little concerned now that the patients may be confused with social media messages, and then some are in favor now of the changes that are happening, others not. No, so how can we continue to transmit and reliable information to our patients and make them trust that whatever we're transmitting is scientifically based, and so that's my question. I mean, I know that everything is a little bit up in the air, and changes haven't been made definite, but if it happens, how to go about instilling trust in the information that we will be providing from now on.
Jason, do you want me to start on that one? So, Daisy, you bring up a very valid concern. I think we all of us in public health are having the same concern as you. We do need to keep in mind that public health has always faced this struggle. We were facing it in the COVID-19 era. We were facing it before then, but yeah, it's maybe at a new level than we've ever had before. And so when it comes to health literacy and building trust, we have some techniques that we do. I think Jason mentioned some of them about how you communicate with a person, about acknowledging their perspective, not dismissing their views. But I think the most important thing to build trust is to be very transparent in what you know and what you don't know. So as health professionals, public health professionals, we always want to say what it is we know based on the evidence, right? And so, there is a lot of medical evidence out there to support what we want to say. And, being transparent about what that is, where you're getting that information from, and your experiences. So all of us in this group have our professional experiences that we can share. Building trust with community members who have historically had good reason not to trust healthcare and universities is meaning that we need to look how we interact with the community in a different way. With Health Confianza, we have wonderful community health workers. Some of them are here in this echo today, who really are the key to building trust within that community. And I'll invite them to say a few words about that. The other way is to work with our organizations. So a lot of our nonprofits and social service organizations already have that trust. Maybe it's a food bank who has been in the community for a long time. Well, they already have the trust of their community members, and now we're helping them being able to deliver accurate health information. So now people can get their information from sources other than just clinics and hospitals and the traditional healthcare system. Do any of our outreach workers want to say anything about what you're doing in the community, all the great work?
We have our patient navigator, a note in the chat, Sandra Sanchez. Do you wanna to expand a little bit more in your comment?
Hi, good afternoon. This is Sandra Sanchez. I'm a patient navigator for University Health. I right now work with the colorectal cancer prevention and screening program. A lot of the times that I can tell is that I need to spend time with the patient, explaining, talking to them, that eye contact, even if they speak both English and Spanish. Just throw it in there. I mean, we talk bilingual down here in Texas, in San Antonio. And so once you do that, I feel like they relax, they get more comfortable. Colorectal cancer is not something easy to talk about with patients, and telling them, hey, we need to do a stool test or a colonoscopy. So I just have to be transparent with them. I have to be honest. This is what this test does, and this is what this test can do for you. And do you have any questions? If you don't feel comfortable, I understand. You have to just be so transparent with them. Thank you.
Thank you very much for your comment. And then you also saying, I think it's good to remember ourselves, our body language will tell them if we're really talking and taking the time to tell them. I think body language is speak so much. Thank you for putting that in the chat. I work in research for health and promotion as a community health worker in colorectal cancer education and prevention. Thank you for all the work that you all do. And you just remind us the very, very important points of communication, transparency, and then the body language. With that, if it's okay to you all, let's move to the case presentation that we have for today. Once the IT person share that in our screens, please Dr. Rosenfeld and Dr. Stone help us to go to that case.
Melanie, you're muted.
Thank you. Are you able to see the slide? Okay. So we came up with, well, we didn't come up with, I'll give proper attribution. These were our partners at University Health who came up with a a whole booklet on scenarios for health literacy situations. I put the website here. Raquel, maybe you can copy that into the chat. And it's something that you all can access for free. I worked with the people who put this booklet together, but what they did was take actual cases from their work at our, again, University Health or community hospital system or county hospital system. And these cases, I think, will resonate with most people. And so we're going to go through one of them today. I chose the medication one because, again, that's such a crucial skill that if you mess up, if you don't understand 100% what you're doing, it can be very devastating. And so let's just, Raquel, shall I just go ahead and read it?
With this, Miss Sanchez, a Spanish speaker mom, took her son to the doctor for a cough, and he was diagnosed with asthma. He was given a prescription for the medication, prednisone, a steroid. The prescription read, take 2 milliliters by mouth twice daily. The doctor asked his staff to give Mrs. Sanchez the instructions in Spanish. The mother saw the number 2 in the bottle and gave her son 2 teaspoons for each dose. After 2 doses, her son felt worse, so Mrs. Sanchez took him back to the doctor. The staff had never given Mrs. Sanchez the instructions in Spanish, resulting in the patient having received 5 times the doses each time he received for the medication. This could have, could be having a very, very fatal results.
Thank you so much for reading that. So I imagine many of you know cases like this. I should have put in, we actually had one case in our San Antonio community not that long ago, where it also would have been a deadly dose to their infant or toddler daughter, and the father had some medical training, and he identified like, hey, this dosage doesn't seem right. And so they, before giving it to their daughter, they did get it checked out, and it was indeed incorrect and would have probably been a fatal dose. And so again, such an important concept. So we have some questions for you about that case, and we can kind of go through them one by one, but how could you improve the information that the patient was given? So I think there's some obvious things here, but let's hear from the group. Like, what would you have done if you were the healthcare provider prescribing this to Mrs. Sanchez?
Any idea of how that can be done? How we can improve?
You can translate the instructions to give her in Spanish.
Translation.
Absolutely.
Mm-hmm.
Yes. And so, it's becoming more common, I think, now in pharmacies, if the person who is getting the prescription filled and they don't speak English, there is supposed to be now signs posted at the pharmacy where they can, even if they can't speak English, they can point to the language that they speak. And, there's a lot of work in the pharmacy industry to make prescription labels translated correctly, like from English to Spanish or to another language. So yes, very much making sure you know your patient, what language they speak and what language they prefer. Elizabeth?
Okay, I have 2 suggestions, and I'm trying to implement that. I was taking a class. I am a coordinator for victim services. I got his eye surgery on July the 3rd. Then I have another eye surgery on July the 31st. On July the 3rd, I have an accident in my way to the doctor. Then on July 31st, between July 3rd and July 31st, everything was a mess. I did have a help aide. What I noticed was the help aide are not being trained the way it's supposed to be, but I'm talking about Washington, D.C. They kind of overlook what those help aides supposed to be doing. They train them, They charge $3,000, and then the intakes, the organization, they cater them to through Medicare. They're teaching just go home and sit down there and whatever she shows you can. At the end of the day, what happened, why I'm putting this example, because it's so important, because I cannot see. I know that the help aid cannot give you the medications. I know that a help aid needs to follow the instructions of the medication because the patient cannot see, and keep records of how many times, because they give you the surgeon give you little holes as you taking the prescription to mark that you already taken. That way you take it the way it is supposed to be. So then at the end of the day, the whole paper got dismissed. The paper, and then if you don't follow the instructions, how you gonna get better, whether it's in English and Spanish. They give, when I address this to the doctor, she give me to me in Spanish, but it's not that. It's the person that is following, because you are just trying to get your medication, you miss, fine, you try again. Now I have, after this surgery, and because whatever transpired on the first surgery, I have the problem again. They made have some new transplants. But here I am listening to this conversation that is so, so important to me, because I decided to take it onto myself, and especially to start advocating for the ADA, because these people, they just don't care. They just go there and they make the hours. Now, there are some circumstances that I have kidney stone at the same time. So the doctor gave me a medication that has side effects. This goes very well on the information that you're talking about. If the person doesn't understand the consequences of a medication that can cause another more serious problem, so to get rid of the kidney stones that I have, which is also, I mean, they're just, I have their doctor's interest on my case, because I had not felt no pain. I mean, it's 3 kidney stones right there, hanging in there, and no pain. So at the end of the day, they give you the prescription to throw away the kidney stones. So when I'm listening and reading, I was able to get my eyesight with one eye that was getting better. And it says that it creates problems on your sight. You might lose your eyesight. And I just like, okay, this doesn't make no sense that I am doing this to regain my eyesight, but then I'm taking a medication that can make me blind. So now I agree everything that you're saying. People don't understand and they overlook, and including, if you don't ask questions, so here you are. This happened to many, many, many people out there.
Thank you, Elizabeth, for sharing your personal experience, and I'm very sorry that you were having, maybe still having a bad experience. And I think what you have said really shows the importance of why we are working to train our healthcare professionals, because we want to give them the techniques to help the patient understand. And I'm looking at chat here. Several people have commented on ways that this scenario could be improved. And one thing they say is teach back. And I think, Elizabeth, that would have helped in your case. Teach back is a technique I'm going to be talking to you more about in a later Echo series. I hope you all will join me for that one, because we will kind of go into the nitty-gritty of that technique. It's not hard, but it's something that does take some skill. Raquel, were there other comments here in the chat?
I think, that's there is another one that I think is gonna be alineated with the validity, the demonstration. How you can demonstrate the doses and for the person. I hear somebody. Okay. Repeat the instructions and ask questions. I was in another comment that says, seems I understanding, but teaching back is maybe we want to talk a little bit more about it. Illustrations and the medications. And then there is another comment teaching how to administer medications, very, very, very important. And I know it's always, I hear a lot of comments when it goes to English and Spanish, because can create a lot of confusion. There is one more comment from Sandra, actually it's a question. Does anyone know if the status have changed from labeling a patient non compliant to perhaps health illiterate? Or not, I don't know, what can be the title, or needs extended instructions. It has been changed. Do you know, Dr. Stone?
And just to follow up, Sandra, are you referring to the patient record, the medical records, how it's documented?
Yes, I am. Thank you.
Yeah, I hope, I don't know, because I'm not an active healthcare professional seeing patient records, so I invite someone who is, but I do hope that non-compliant has been, is not in use anymore, because that's a very judgmental word. But anyone in the audience here who knows the answer to Sandra's question?
Actually, I sometimes hear adherence. I don't know if someone has heard that, or how do you refer to a person that needs a little bit more?
Non-adherent is better, right? Non-adherent doesn't have as much judgment connotation. It means there's a reason why they're not adhering. But anyone who can answer about the medical record, please include in chat. And while you're doing that, I just wanted to comment on a couple of these responses here. Someone mentioned pharmacists. Pharmacists are such an overlooked health asset for health literacy. So people may feel intimidated to ask questions about their medication to their health doctor or their healthcare team. They may not have easy access to do that. It may not be very easy to communicate with your healthcare team in a timely manner. However, everybody has access to pharmacists at HEB or Walgreens or Walmart. I can't tell you like how many times I personally use my pharmacist, by the way, who is the expert in medications and patient and medication interactions. You can ask them your questions. If you're confused about the dosage, if you're confused about how many times to take it, if you're not sure about side effects, the pharmacist knows and they can answer you. Just walk up to the counter and you say you want to meet with a pharmacist. So I'm glad that somebody pointed to that out. And then there was one more.
Elizabeth, also, I see that you can. Elizabeth, and then I have a Sandra also, I see a hands up. You have a comment question, Elizabeth? Ms. Mandela?
Yes, so that situation, what you guys doing is something that I am very proud of you guys doing that, because they don't have this over here in DC. And the problems about non-compliance is that everybody's because they are working together, so they have the tendency to sweep it under the rug. I have so many complaints, but nobody to write them because they are clients of the clients, and it keep going like that. And this is when the situation with the patient kind of diminish. So I think on many cases when they are serious, I think the most of the time when it's serious, like in my situation, that I have my nurse, they did the assessment for the insurance. Sometimes they are the one they found out where's the crack, and because they are also have to follow the compliance. So most of the time, what is happening in DC now is the nurses quietly doing the complaint when they doing the assessment to the patient. So that's grateful, but there had to be more soldiers out there, you know? They hold these people in compliance, because if they're sending new crew to help patients up there and these people are not trained properly, don't try to stick with your, oh, we train our staff, obviously your staff is getting paid $3,000 a month to do nothing, just to sit there. And if the patient cannot move out of the bed, and you have to clean that person up. So whenever you feel like despair, then you go ahead and clean up the patient. And these are things that I'm taking over to myself, and that's what I'm taking all these classes. So they are victims. They are being victims of the help aides, where they're supposed to get paid to help the client to get better.
Thank you so much. You shared with us very important points, very sensitive, and we appreciate the trust that you have in these sessions. And please keep sharing those stories, because this is the essence and this is the heart of the Health Confianza and the heart of the eco sessions, that we all learn a little bit among ourselves in those sessions. And respecting the time from everyone, and I'm glad that we have this started. I'm super happy. We just keep the mode, right? And then you wanna mark your calendars, but I will go back to Dr. Rosenfeld maybe in a couple of minutes. He can just give us a summary of the discussion of the points that we discussed today, Dr. Rosenfeld.
Yeah, no, I think it was a wonderful discussion about like kind of just some core principles around health literacy and how do we do our best to meet individuals. And Melanie knows me well. I don't like to always use the word patient because then it implies that you're in a clinical setting and not everyone is a patient. But how do we help people find their paths to health, right? And so clear communication, finding allies to help us, whether we're able to do it ourselves or not, whether it's a pharmacist or, as I put in the chat, a community health worker. And so again, this was a foundational session, and we want to encourage everyone to come back to our following sessions where we're going to deep dive into core health literacy principles wrapped around common preventive health topics. So hopefully I did that justice, Raquel, but please feel free, Corinne, or others to add.
No, thank you so much, and thank you for putting your heart and vocalize your concern. This is the essence of these sessions. As I said, we promise we're trying to read all the chats, and just briefly, the time assigned to treat and educate patients is limited. We need to allow enough time to each person and follow up. Sorry, it was moving, and follow up to check up understanding. Thank you so much for joining our session today. Thank you. That was an excellent discussion. Please mark your calendars and come for the following session. We're looking forward to see you in our next session, September the 19th. You have the information in the chat about the continuing education credits, and we're looking forward to see you here next time. Until then, you have a wonderful rest of the day. Thank you so much.